Okay, so I will be just discussing some aspects which I have discussed actually number of times before as well. And
Sure, sir.
if you are like aware of the things which you should be doing during your residency, and how can you excel in your career in a better way, that's what
Sure.
I want from all of you. Okay. Um, Actually, uh, this anesthesia is a multi-dimensional specialty. Okay, we are not confined to like any other specialty. The field domain is very limited, and they are just like, for example, if orthopedic, the basics of orthopedics is the same. Okay, yes, alignment will be different, fracture site will affect a number of things, but the basic principles are the same. Okay, so even if it is like that, they have a limited domain. Similar is true for eye, similar is true for, but as anesthetist, your domain is so vast and it's so big that actually you cannot confine yourself to a bit of knowledge. You should be knowing about like you are when you are in doing neuroanesthesia, you should be knowing about basics of neurophysiology, how ICP is being affected, and things like that. Similarly, in whatever OR you are working, you should be knowing about the base core knowledge of that specialty if you want to work in a better way, because otherwise you can as a technician or without any baseline knowledge, you can work without it as well. But if you want to justify your presence, you should be knowing more than uh, what is required by any other person. You should be the most knowledgeable person in the anesthetist. I just in the OR. I say that the care provided by anesthetist is just like care provided like like a mother, and the surgeons are like father, because the whatever care a father gives, there is no replacement to mother. So similarly, anesthetist provides the care like a mother. So that's what you should be thinking, that you should be, even if the positioning is not good and patient happens to have something dislocation or some nerve injury, or some, even for example, you have a very difficult IV line and you did not uh, put the dressing properly, and the IV line comes out, this can create a big problem for you. Okay, so things like that, you should be aware about the temperature, you should be knowing about the blood loss, you should be knowing about everything. So that makes this specialty very challenging. Okay, so you have to be very aware of the situation, what's happening about the surgical side. So that is you should be concentrating, and you should try to learn the cases the best, and the most important thing which I will suggest to all of you, that you should be reading your cases, whatever cases you are doing. This should be the first thing for you to do. Okay, so this is another thing. One more thing I would like to ask you, that if, for example, if any one of you want to pursue your career in UK or Ireland or America or like any other country, you should be knowing the pattern which you need to follow if you want to join there. For example, if I just start with the things to be done in for UK, just a second. So if you want to, the first thing you will be needing is in UK, the general medical GMC registration. Okay. So for GMC registration, one thing will be the language exam, which is either OET or IELTS. Okay. And the other thing which will be required will be the licensing exam, which is called as PLAB. Okay. So either you need to pass this PLAB or you need some exemption. Okay. So exemption from PLAB, a number of like up to Up to recent years, the FCPS anesthesia of the fellowship from Pakistan was in the exemption list, but now they have finished. Still, they have exemption for some of the degrees, like for some of the degrees which I will tell you, FCAI, Fellow College of Anesthetists, Ireland. If you have done this or you have done EDAIC, you will be having exemption from PLAB. Otherwise, you need to do PLAB. So once you have got any exemption or you have done PLAB, then you can register yourself with GMC after OET or IELTS. IELTS requirement for UK is 7.5 overall and 7 each. Okay, so you need to have a good score. And OET, I'm not sure about it because I have never been to OET. I have not done it. So, but I think there is 350 score is required, if I'm not wrong. OET is related to English language, occupational English testing. So whatever English they are testing you, it's related to the conversation between a doctor and a patient and things like that. Okay, you need to write a referral paper or you need to counsel a patient or something like that. Okay, so the things are related to medical sciences. So this is an IELTS, it's a general test. Academic IELTS you need to do. Okay, so what are the if once you get the according to your experience, if you have less experience, they will take you as SHO in anesthesia, and then you after a few months or 6 months or some things like that, you will become registrar. Okay, so actually the thing is that which the people are unaware that exams, the UK system is exams is separate and training is separate. Okay, and there are some people who are doing what's called as staff grade job, which is non-teaching, and you can say they are doing a certain limited number of cases, ASA 1 2 something. There is limitation for them. I'm not sure exactly, but something like that. They cannot become a consultant, but they are working independently, and their salary, they are earning more than even training people. Okay, so they are earning more, but they will never become a consultant. Their domain will be a limited one. Okay, so this is, but for becoming consultant, either you have to complete a training program and you will be getting this certificate of completion of specialty training, or there is an alternative pathway which is called as CSER, CESR. Okay, certificate of equivalence of specialty registrar, something like that, and certificate of completion of specialty training. So these are two different. I think there is 7 years training, if I'm not wrong. Okay, but the problem is that it is not easy, or not everyone is guaranteed to get into the training. Okay, so you need to, because in some parts of world, like in Pakistan, for example, if you have done FCPS Part 1, you can register for FCPS Part 2 training. There is no aptitude test usually in majority of the institute, and you can join any institute if you are fulfilling some of the criteria. Yes, in Punjab they have make it very strict, and there is just central induction policy, and they are having some scores and numbers and things like that, but still everyone will be getting the training in one way or other. You can go to private hospitals or something like that, but in UK, Ireland, the system is different. You just need to get a job first, and then if you are satisfied, they will be allowing you to enter into the training program, and this will be competency based. Like they will be assessing you rather than blindly allowing you. Another thing is that people are attracted by this exam, FRCA primary and FRCA final, and there is one exam for ICU ADIC, and there is one exam for this anesthesia and ICU EDIC, and there are European diploma in regional anesthesia, things like that. But remember one thing, these are all separate. These exams are separate and training is separate. There is nothing, there is no relation. Yes, if you have passed the exam, they will say that you know something, so now you have a fair chance to get into the training. Okay, so but there is no guarantee that if someone passed the exam, because primary FRCA, you can appear even if you are not working in UK. You can appear in primary FRCA if you have certain experience. in anesthesia. But for final FRCA, you need to work, if I'm not wrong, 12 to 18 months in UK, in NHS, and then you can appear in final FRCA. Okay. So it's one of the requirement for getting the CCST, but it is not mandatory. Okay. You can pass it later on if you are in the training program. The other pathway is CSER, CESR. Like, for example, if you are trained in some part of the world, they accept some of the trainings, like whatever training you have done, they will take your papers and they have a certain criteria. I have, by the way, I have in previous discussions of career counseling, I have put the link for some of the documents related to CSER and things like that. So you can review them. Okay. And I have never seen it, but I know that there is some certain that they need a certain number of experience in last 5 years related to a certain number of procedures, a certain number of cases, certain number of experience. Okay. And you have to show them the papers and you have to sign the competencies. And then when it is done, then you will be sending all the papers to the Royal College, this GMC, and they will enter you from the general division. They will be making you in the specialty training, specialty registrar. Okay. And once you have the specialty registrar, then you can become consultant. Okay. But still, there is one consultant who has done CSER pathway, and one consultant who has done CCST pathway. This will be number one and this will be number two. Okay. So if they will have CCST and they will be someone CSER, they will prefer CCST because they have done training in their system. So they will definitely prefer it. So this is just few basic things. And the salary, I am not 100% sure, but again, because I have not worked it, somehow whatever information I am sharing, maybe we need to be corrected by someone who's working there or who has more experience. But I'm just trying to guide you the basic information. The salary, which is after tax, is around 3,000 to 5,000 pounds. And then you need to work some extra hours to earn something more. But usually the earning is around that. And it also depends on the area you are living, that how much you can save or how much you need for expenditure. If you are living in the main city, you need to pay more for the expenditures. And usually the schooling is free. So it is easy. Health is free and schooling is free. So it is easier for you to survive even with your family. So this is something basic. Similar is true for Ireland. And Irish exam is the name of Irish exam is press. And there are some exemptions for Pakistani people. The people who have graduated from Pakistan after 2008, I think, or 9, and they have done house job in 6 months, medicine, and 6-month surgery. They are exemption. They are getting exemption for press exam. Okay. Or if you have done FCAI by some way, because if you have done FCPS, MCAI will be exempted. MCI is like primary FRC. Okay. So it is the primary exam. If you have done primary FRCA, or if you have done, for example, FCPS is also in the exemption. If you have done FCPS, MCI will be exempted. No other degree, neither MS, neither MCPS, or nor DA. Okay. And no other degrees from India like DNB and this MD, there is no exemption for them. So if you want to do it, you have to pass both the parts. But if you have done European diploma in anesthesia and ICU, this EDA-IC, you will also have exemption from MCI. Okay. So with EDA-IC, you also can appear in FCI. But again, the thing is that this exam is nothing. Separately, practically, this exam will only give you knowledge, and but nothing more than that. So you should be very clear about it. The rest of the system is almost the same. The training is almost banned for non-Irish people in Ireland. CSER pathway is there. Okay. But the problem is that you need to work for a longer period of time than UK to become a consultant. and for both of them around 5 to 6, 7 years for passport. So these are the advantages for the young people who want to prosper their careers. It is better for them to go at the earlier time of their age, when their kids are young and they have more time to settle down. Because if they are going at a later part of their career, because the education before university is easier to get in UK Ireland. After that, it is difficult because it's become very expensive, and it is not possible for you to it's not easy to afford it. Okay, for the children. So you should be just knowing few facts about it. I will tell something about this Saudi Arabia. Where I am working. Okay, and in Saudi Arabia, actually, the one thing is Ministry of Health hospitals, one is private hospitals. Okay, then there are autonomous medical cities and university hospitals. I'm also working in one of similar like that. And after that, there are Ministry of Defense. There are like hospital of military and security forces. Okay. And after that, there are two institutions which I happen to work in both of them. One of them is National Guards. Okay. And the best hospital in Saudi Arabia is King Faisal. King Faisal Specialist Hospital and Research Center. So I was very lucky that I have worked in both of them one by one. But the thing is that Pakistani qualifications or even any other qualification cannot become consultant till the time you have CCST and you have 3-year experience as consultant to become consultant in these two hospitals, especially King Faisal. So it's a different world, but there is no hospital in Saudi Arabia or even in whole Gulf better than King Faisal. And number 2 is National Guards. And the most terrible is Ministry of Health, because they will send you to periphery, in mountains, in deserts, where there will be, yes, all the amenities will be there, but if you are trying to live with your family, there will be no schools, international schools, and not except for Dammam, Riyadh, Dammam, and Jeddah. These 3 places are worth living. Dammam is actually triplet. 2 other cities are also associated, Khubar and Dehran. Khubar, Dehran, and Dammam. These are triplet cities. They are together. Jeddah and Riyadh, because there are international flights to any other country, usually from these 3 cities. Any other city, there will be problem related to direct flights. There will be problem related to schooling. Yes, isolated, you will find some Indian school, you will find some Pakistani school, but usually there are so many problems. If you are living with your family, only 3 cities are worth living, where you can have everything without any trouble. Otherwise, of course, you can compromise any other thing. You don't need to travel every time, but at least you need schools. So if you don't have the schooling for your kids, you cannot survive without family. So this is a very important thing. And because recently in Saudi Arabia, there is, like any other part of the world, inflation is so much in Saudi Arabia. So things have totally changed. So to people who used to think that it is to say like a heaven to save money, now things are not like that. Another important thing is that in Saudi Commission registration, there are 3 or 4 categories which you should be knowing: consultant and resident. I'm writing resident separately because now it is very difficult to get registered as resident without a degree. Like, for example, if you have in Pakistan, Pakistani people who have DA, they will not be even considered as it's not acceptable. So maybe they will not even allow you to get registered as resident anesthesia. Okay, they will ask you to do GP exam. For all residents, there is GP exam, which is clinical sciences. Okay, clinical sciences exam, just like step 2, USMLE step 2 course, you can say. that it is like that one. Not exactly like that, but it is like that. So other, if you have done MCPS, so fresh MCPS can be registered as a resident. I'm not sure about DA for resident, but maybe they can register. I'm not sure. MCPS, fresh MCPS is resident. MCPS plus 2 years is registrar. Okay. Fresh FCPS is senior registrar. Okay. And after 5 years of FCPS, then you can be registered to consultant. So I am after I did FCPS in 2014, 2013 December. So I became consultant in 2019. Okay. So it's a long journey, not so easy. It's a way and another thing is that before there used to be uncle's home. Like Saudi Arab was just like uncle's home for people coming from Pakistan or India, especially. So, but now because there is so much saturation, so now it's not easy there to get a job in good hospitals, in autonomous hospital where you can have a better living. Okay, so it's not so easy, but still you have a chance. You can get a job, and depending on the hospital, there is no fixed salary in Saudi Arabia. And different hospitals have different pay packages, but usually the registrar are getting around, you can say 18,000 to 25,000, and consultants in different hospitals are getting around 25 to 35,000. Okay. In Ministry of Health, the salaries are less. And in autonomous hospital or university hospital, the salaries are better. So this is all about for this Saudi Commission registration. There is a prometric exam, okay, which is just like to choose the best questions, just like you can say Bryony Hall pattern or anesthesia comprehensive review pattern or Lippincott pattern. Anyone who wants to, I have some pool I can share with to you, but usually it's not very difficult. You can easily pass it. And so anyone wants to ask any question or anything? Okay, so one thing I will just tell that if you want to go to USA, that is the best one. And actually people have a lot of confusion because they think that getting residency in US is very difficult and this and that. If you have done a post graduation from your country and you have done USMLE, you just have to pass it. You have to do step 1, 2, 3 and OET. And you just have to pass. You don't need to get a very good scores, and you will be getting registration with ECFMG. You will become MD USA. Okay. And then you will apply for fellowship, not primarily for residency, because this fellowship will be 1 year fellowship. Okay. And you will be getting adequate amount to survive even with your family. So this is what you will be getting. And then after that, you will have a number of options. You can come back, and this fellowship is proper training. So that will have a lot of worth, better than working for 5 years in UK without a training position. So this is one thing. And other thing is that there will be a chance that they can offer you residency. This is, if you are good, they can offer you residency. Other thing is that getting first fellowship may be difficult, but after that, once you are in US, you can, once your first fellowship is finished, then you can look for other fellowships, and you are able to get 4 fellowships. You can register as a consultant. So this is something, a pathway which people don't know. So if you ask me, if you are a young graduate, I will ask you to do USMLE. That is that there is, because if, for example, it's a win-win situation. Even if you are not able to get the fellowship in first go, you have all the time in the world. You can get it one day. Number one. And number two is that the knowledge which you will be getting by doing USMLE, that will be helping you throughout your career. No anesthesia exam will be difficult for you if you have done USMLE. So, and even in preparing for USMLE, physiology, pharmacology, okay, anatomy, pathology. These are the main subject, not biochemistry, not genetics, because people are afraid of these subjects, embryology. So don't be afraid from these subjects. Even if you are good in these subjects, you can pass it. Yes, of course, you need to read it. But if you are focusing in your during your residency, just try to be in touch with Kaplan, USMLE, UWorld, when you are reading thyroid, because the same thyroid function will be there even if you are reading it for USMLE. Thyroid hormone will still be secreting thyroid hormones even in USMLE books. So it is better for you just to have a taste of it. So it will be easier for you if you want to do it later on. Okay. So this is one thing. And another thing is that it's a win. And another good thing is that if you want to go to UK, so actually if you have done USMLE up till now, you can get registered with GMC as well. After some time, some rules change. I'm not sure. But at the moment, if you have done USMLE, you can get registered to GMC and you can go to UK as well. So it's a win-win situation. And USMLE is recognized in New Zealand. Not many people know about it. Once I had just applied email to their council, and they had told me that if you have done USMLE, you can enter in our training program. So like it is just like that, that I will suggest you to do USMLE where at whatever career. Even I really I'm too late, but still I have this impulse in my mind to do it at some point of my life. I wish it. I don't know I will be able to do it, but I really wish to do it. Okay, so my suggestion, all of you, please do USMLE and leave it on Allah that whatever is the best, you will get it. Few words about UAE, Bahrain, and this Oman, because I don't have much information, but usually remember one thing, that they all have their licensing exams. Like for Dubai, there are 3 licensing exams. One is DHA, one is HAD, and one is MOH. So actually DHA is only for Dubai, HAD is for Abu Dhabi, and MOH, and this is MOH and prevention. This is for the rest of Sharjah, Queen, and Ajman, and rest of the states. Okay. So I think I will finish here, and any one of you have any question, you can just drop a message to me. Okay. I think.
Sir, excuse me, sir.
Yes, yes.
Yeah, good evening.
Yes.
Actually, can you please tell me about the 4 fellowships that you have told? If I have 4 fellowships, how
Yes.
do I register for the as a consultant in US is what I wanted to know.
Actually, you know, I will tell you something, Randhir. You have my number. You have my
Yeah.
number. Yes, just do a favor. Actually, someone has come on my home. Okay, someone just
Okay,
get
no
so I
problem.
have to leave. I will definitely answer to
Yeah.
your question.
Yeah.
Just drop a message to me. Okay, I will answer to
Okay,
you. I'm not 100% sure about it, how to apply for it, but that's for sure, that if you have got 4 fellowships, you can register as a consultant, because the 4 years residency will be counted in 4 fellowships, and you can
yeah.
register as a consultant. That's what I know. Okay. Rest, of
Yes.
course, when you will apply and you will go, remember one thing, it's a win-win situation. Remember, another thing is that knowledge is like ibadat. Okay. So if you are trying to get the excellence, I have worked with the UK trained people. I have worked with Irish trained people. Believe me, there is no comparison to American trained people. I don't like America, but there is no match to American training. The American training is the best. Okay. And
Yes.
American salaries are the best. There is no comparison.
Definitely.
Even
Definitely.
okay. So rest
Yes.
of any detail, you just drop a I have put my number in the drop message. So just
Yes.
contact me, just drop a message, and you feel free to ask anything. Okay.
Yes. Yes.
Okay.
Thank you.
Okay. Bye bye.